Hi, good afternoon. This is your County Executive Ed Day. We're here for our weekly update on COVID-19 here in Rockland County. I'm here today with my man behind the curtain, John Lyon, my communications director. He has been fielding your questions, and I thank you for your engagement. And John, let's have at it.
Okay, I'll get right into it with a question that's on a lot of people's minds right now. Why can't you just open everything up again right now?
You mean just do it?
Just do it.
Just do it. Okay. Well, look, I've seen this a few times. It often, quite directly and on social media, sends a little bit of anger and frustration, which is very understandable. But let me be straightforward with all of you. Words are easy. Responsibility is hard. There's a process that was set up for this, and while we can always disagree on a lot of this, the process that they laid out makes sense. There may be tweaking and turning that we have to do, but realize that this spike, this attack on this community of this virus was overwhelming, and it was put under control. We believe we are hitting most of the right ideas about how to do that with social distancing, face coverings, and the like, and good hygiene, of course. Now, how to come out of that situation? We've knocked this virus down tremendously. Our metrics here in Rockland County are superlative. So now what do? Flipping a switch, I think, would be reckless. I just don't think that's the way to do this. And the process that was set up was designed to be gradual and least impactful by stage. There's 4 different phases that most of you know about already. The first one is we're in phase 1 now. Phase 2 will be offices will be opening up. We'll have full retail administrative support, finance, insurance. Most of the businesses will be opening up. Phase 3, an area where we know there's a lot of social gatherings, restaurants, and food services. And phase 4, arts, entertainment, huge gatherings. So that's the way the process has been set up with 2-week intervals as the plan. The road to hell is paved with good intentions, and the state has been clear. If rogue businesses start opening up, they will be fined $10,000 per day. If they have licenses, the licenses will be pulled. So for me, in good conscience, to tell a business owner who I may actually know from the community of Rockland, oh, hey, good, don't worry about it. Nobody's going to catch you. Next thing you know, he gets a visit by state troopers, the state attorney general's office, and he or she gets hit with a fine of $10,000 each day. I can't in good conscience recommend that to somebody. That would not be right. And while I understand the frustration, at the end of the day, we have to do things the appropriate way. We can advocate. In fact, there's something that did come up today at the control room conversation we have every day with the governor's people. I'm going to bring it up, but that is a classic case of advocacy and trying to make our point out here in the field so the Albany understands that maybe the way they're approaching it could be done a little differently. So we'll bring that up in a minute. But understand this, there's a 2-week breakdown, and right, phase 1 we entered into May 26th. Phase 2 is scheduled for June 7th, phase 3 for June 23rd, phase 4 for July 7th. Yes, I know that's after 4th of July, we've brought that up already. But here's what it comes down to. There are caveats here. If we can do this a bit quicker if the news is good. If we are looking at the infection rate, for example, because we look at it every day, the information we have is almost real time. If we see an issue developing, we can address it immediately. If we see things are going slower, we should be able to open up a little bit sooner. The governor's been very clear. He's not locking us into 2 weeks. So the 2 weeks is really more for projection purposes, so somebody just have an idea of what our timeline is. But at the end of the day, we should work together, do what we believe has been working in knocking this virus down. Social distancing, face coverings, and good hygienic habits. Remember the old saying, we told our kids this, wash your hands, 20 seconds, soap them up good, rinse them off. But remember, we'll be guided by a simple motto, safety first and people always.
And just one quick clarification, when the county executive was discussing the 2-week timelines for each new phase, you misspoke and said June 7th for phase 2 as opposed to June 9th. June 9th is June 9th? Two weeks from when we entered phase 1.
I guess I'm being optimistic.
Yeah, that's a Sunday.
Okay.
Would be preferred.
Okay, there we go.
Moving along, we've been talking a lot about the contact tracing process, increasing the numbers of people who are able to do it here in the county and across Rockland. Can you explain a little bit what that process is and what the guidelines are for those who are contacted?
Got it. Okay. The testing is performed by either New York State or by a private provider. You are provided with test results. If you test positive, this information is also shared with the health department. Now, you will then be contacted by a contact tracer, and we'll ask you a number of questions regarding your symptoms, the places you visited, anyone you may have inadvertently exposed to the disease. This information is critical so that we can reach out to the people and places who may have been exposed so they can take protective actions, such as undergoing precautionary quarantine, if it's a person who was exposed, or deep cleaning a place you visited, if it was a business or even someone else's home. Now, the latest information we're getting now is that the virus living on surfaces is not as lengthy as that the experts originally thought. And thankfully, that's a good thing. Unlike measles, where it lasted for a couple of hours, that's a long time on a surface. To date, we've had 351 Rockland County and other municipal employees who have completed the Johns Hopkins Contact Tracing Training Program. These are volunteers. They are employees that have done amazing work here. I want to take a moment to thank them and thank each and every one of them for the people who stepped up on short notice and completed the online training. I want to include the fact we have municipal employees from various towns and governments and just regular citizens volunteering to help out. We're now well positioned to track any possible resurgence in case in real time to prevent the further spread of the disease. I can tell you that our GIS personnel and our planning department have worked tirelessly with the health department to find ways of getting this information in almost real time when we find infections. And we've done that. The information is so detailed, we can't release the specifics of it because it actually would identify homes, which we don't want to do, obviously. So at the end of the day, we're able to immediately notice any kind of spike by area and address it. And I will tell you, having gone through the measles epidemic here in Rockland, which, again, I'm very proud of the fact that we were looked at as a template for how to attack the measles epidemic. We used it to great effect then because it helped us bring the outbreak to a stop. And we expect to be able to do the same thing with the COVID-19. The goal here is a very simple one. Interrupt the virus. Keep it from spreading. That's what the idea of contact tracing is about.
Okay. Thank you for that thorough explanation.
Hey, that's what I'm here for.
Another topic that's gotten a lot of talk about lately, will there be hazard pay for those who have been on the front lines during this pandemic?
I like the idea of hazard pay. Having been a former New York City cop, I certainly can identify with the need for hazard pay. But recently, the federal legislation was called the HEROES Act. It would establish a $200 billion fund to ensure that essential workers nationwide who have risked their lives working during the pandemic receive hazard pay. This HEROES Act has been passed by the House of Representatives. It has not yet been taken up by the Senate. So it is unknown at this point, and when it will move forward. If we hear of anything, obviously we'll get that information out to you as rapidly as possible. And again, I think a moment here for all of us who are watching that are those frontline workers, just not our EMS, our fire officers, our law enforcement personnel, our nurses. There are also that young man or lady who's on the other side of a cash register at the local grocery store. That person has come out to work every day with the same concerns and worries you had, and to ensure that you have a food supply. Just think about that for a moment when you speak to these people. Give them a little smile once in a while, make them feel a little bit at ease. It's a good thing to do, it really is.
And I encourage you to use your words to thank these people, because if you're smiling and have a mask on, they may not see it. So
but
go a step
Irish eyes
further.
are smiling. All right, we have to hope that works, because when I go out, I got the Irish eyes.
Fair enough. Weather's starting to warm up. We had a very nice weekend. Why are beaches open, but pools, particularly condo pools, why are they closed?
That is a very, very good question. Originally, the logic that was offered to us by the state, as you remember, the beaches were declared to be open. This was right after New Jersey decided to open their beaches. New York State did the same thing. And the belief that we heard in our daily control room teleconferences, just to digress a second, that's where We have all the county executives in the 7 counties in our Mid-Hudson region, along with some of our staff members, members of the governor's staff, the health department, and others from Albany. They explained this to us because they felt it was easier for people to maintain social distancing, particularly the beaches in New York State, because you're allowing only 50% capacity. So their perspective was a lot of room. We can monitor that. Those of us who've gone to the beach didn't really fully agree with that logic because, first of all, it's very difficult to control people on a beach. It just is a lot of work, and with condo, HOA pools, pool decks, etc., they're generally a small area to work with. Oftentimes, they're known clientele who are there, especially in an HOA. The ability to ensure compliance, we felt, will be easier. The good news today is they heard us. And from today's control room teleconference, effective immediately, condo pools, HOA, municipal, and public pools that were going to be in phase 4, that was July 7th, now they have been granted authority to open immediately with limitations that are being worked out right now. So the good news is, with a little bit of luck, depending how fast your municipality or your HOA is working, you may be able to take a dip in the pool come this weekend. So we'll see how it plays out, but that's good news. And again, instead of arguing and fighting with other levels of government, we advocated, we made our point smartly, directly, and respectfully, and again, we were heard, and we got something out of it. That's the way you govern. That's how we get things done here in Rockland County.
Any updates you can share with us on camps, summer programs, those types of activities?
I've been getting calls all day from folks who I go back many, many years with. It's very frustrating. We have continued to bring this up at the governor's staff during our daily regional control room calls. They understand it. They have not yet made a decision. I sense this has gone on a long time now. I sense there are some honest differences of opinions in Albany between the health department and others. That's conjecture on my part, but the fact of the matter is we have not forgotten this. We know it's important to so many people, and we will keep nudging them as much as we can.
People still have a lot of questions about what specific businesses are in certain phases. This next question is, do you know what phase gyms will reopen as part of?
The gym should be in phase 4, but again, a lot of this is very specific to each location. So what I would suggest people do, and even if you have a general question about the phases, about the businesses, about how this is going to work, there's an excellent website put together, and it's forward.ny.gov, forward.ny.gov. Go to that website, navigate through it, take a look at specific questions such as this one, see where it falls, and we'll go from there.
Some stores in the area have transitioned into a model where they're trusting customers to do the right thing, such as wearing masks. They're not checking at the door, that type of thing. What do you think about that situation?
Well, it's about 6 weeks or so, maybe 8 weeks or so, we put in a recommended executive order that would mandate masks or face coverings on people who go shopping. We felt that plus making sure that entry was controlled with the egress, 6 feet apart, those social distancing things. We laid that all out. We sent it forward to Albany, and Albany, the health department said no. What they did instead is they turned around, took our language, and they made it a guidance, they called it. It says, okay, we'll take it. But again, my own personal experience going into stores, if somebody's in a store now, and most people are following the rules, one person without a mask is going to create a problem. You know, sometimes guidance is great, but you have to have the force of law behind it, I think, and something as close to that did come up today. Governor Cuomo, in his daily briefing this morning, said he was going to sign an executive order explicitly granting businesses the right to require people to cover their face in order to enter, similar to what we had recommended a few weeks back. Now, to be clear, there's no legal penalty. This is not, if somebody does not wear a face covering and goes into a store, it is not a violation of the governor's order. What it does do, it gives the store owner the authority to tell that person he or she must leave. Just like if you're not, no shoes, no shorts, t-shirts aren't allowed kind of scenario, the store owner now has a right to say, you cannot be in here. Refusal to obey that direction is a trespass situation. The police can enforce that. But it does give them, it gives the business owner power to require a mask, and it also clears up any potential legal issues that, such as a requirement that violates anti-discrimination law. You know, the governor says he believes this would, the order would help reduce conflict between store owners and potential customers, and frankly, not just store owners and customers. I think it will minimize conflict between customers, and I certainly agree with that approach.
Okay. And there are still a few questions in the chat along with the next question here. What are specifically the criteria being used to determine when we can proceed through phases? And can you just run through that timeline again?
Sure.
Real quick?
Basically, as it stands right now, Phase 2 will start Tuesday, June 9th, as John mentioned earlier. And we have heard that specifics for Phase 2 may be posted very soon on the website that I mentioned, the forward.my.gov. So certainly check that out and see what information's there. And as stated earlier, if the numbers warrant it, we can make a case for a change or a shift in the dates. And that's something they told us straight. And you've listened to the governor when he speaks. He's gotten off the 2-week standard that he initially was involved in. Now he's being a little more liberal in his words about when we go to the next phase. He's pretty much leaving the dates out of it. So, you know, from my perspective, how I read it as the county executive is that he's looking for some latitude as appropriate, and it can go either direction. The criteria for future phases is the same as phase number 1. We must maintain or improve upon the current metrics. Now, it doesn't mean that that once we meet the metrics on the latest sheet, some metrics are met and we're over, we're done with. What they mean is that as we look at the rate of infections, if we see increase in hospitalizations, things like that, those things are going to affect the decision as to the date of when we go to the next phase. If we see a spike in infections with no effort, no success in combating it, we see an increase in hospitalizations, fewer beds available. As you remember, a while back when this came up, the fear was we'd have not enough beds if things went back again. We've got a second wave now. That's the concern. So once we look at that, that could push the date out. If we see that we are maintaining what we have or even improving upon it, that could make the date come sooner, either way. So that's where we stand, and again, as I said earlier, this is a safety first, people always approach.
Up next, when is the Office for People with Developmental Disabilities, this is the New York State office, going to reopen group homes for visitation?
Okay, look, we share your concerns about the group homes. I've had a couple of phone calls today about a couple of local group homes, and we've seen media reports of group homes with short staffing or staff being floated from homes with COVID-19 positive residents to homes without infections due to staffing issues. The New York State OPWDD, the Office for People with Disabilities, has said that they are working with the New York State Department of Health to establish a process so they can safely begin returning to regular activities, including a phased-in approach to the resumption of programs and visitations. I will tell you what I take away from this right now is, given what occurred with the nursing homes and the tragedies we saw, I can pretty much guarantee you that the State Department of Health is being very careful with this right now and doing whatever they can do to make sure there's no repeat performance of tragedies such as we saw in the nursing homes. Now, it's promising to hear this, that they're working on something, but I understand your frustration and not being able to see your loved ones. It's a very difficult thing to do. But the OPWDD is encouraging family members and others interested parties to sign up to receive the regular updates. That website is www.opwdd.ny.gov. Again, www.opwddd.ny.gov.
Okay. And speaking of state agencies, when will the New York State Department of Motor Vehicles reopen?
Okay, if I said Monday, no, I'm going to count. All the field offices are still closed, obviously. That's why we got the question. Some things can be done online, other things, unfortunately, going to have to wait till the DMV offices reopen. You can be rest assured this has been another regular conversation on our calls. I don't understand what the issue is with the DMV and why it's closed. But again, we keep bringing it up to the state. They have not shared any information about when or a timeline that they'll see a reopening of the DMV. But for more information on anything related to the DMV, certainly go to their website at dmv.ny.gov, dmv.ny.gov.
And what's being done to help the businesses that have reopened or will soon reopen?
Okay,
I know
well,
a lot of them are in tough shape now.
Yes, they are. And you know something, it's the right thing to do. The local businesses, especially the small businesses, they're having a tough go of it, and it's great to see. And I want to thank people who've gone to these restaurants in particular and ordered out, and just giving your neighbors a lifeline. One of the things I saw on Facebook that is so true about helping your small business people out is that when things happen with the large corporations, you're paying for some person making $8 million a year and maybe a fourth home or a yacht. When you support local business, what you're doing, you're supporting a local business that are the people who support your Little League, will sponsor various things for your children in school. They will have employees who will run out the door when they get a fire call because there are volunteer firefighters. So it's important that we understand that small business is a critically important piece of our community. I'm not even going to go into our economy, but our community. They are a critical part of it. So one of the things we're doing, and we've done this in other areas, we are offering, we've started the RockGov Face Cov program. And this is what we can show you. John, tell me if I'm centered here.
Yep, that's good.
Okay. The RockGov Face Cover program. 100, by the way, just so everybody knows, this is not what the mask is going to look like. This was John Lyon's rendition of what to put on the front from an imagery piece. So we're not paying money to send out RockGov Face Cov mask. It's not what we're doing. We have been getting a number of donations from various groups when it came to PPEs, including face masks. So what we're doing is we're going to pay it forward. We're going to be offering 100 masks to any small business or nonprofit with up to 20 employees, so they have them on hand for their own personnel. It's a seed. It's to get them started as to what when they start opening up and having people come in. We're trying to give them a hand here. We see our role here in Rockland County government to be part of the solution to the crisis that we are facing, and key to that is facilitating the health of our residents and the reopening of our economy. This effort here, we've already done this with our seniors, with our veterans, with our first responders, our municipalities who in turn did giveaways for the local residents in their own town, and people in need. This is something we've been doing along the same lines. So we're taking a good deed shown to county government and return that good deed to the people who actually own the government, the people. And this is what we're trying to do. So we understand there's an ongoing demand for personal protective equipment, and the RockGov Face Cov program will provide free face coverings to small businesses as they welcome back their employees and help them get themselves back on track. We have other plans that we're looking at, which I'm not going to disclose at this moment, that will be designed to reinvigorate the economy, to help get our people back in and help our citizens, our residents, to get back to as normal as possible as soon as possible. Look, we're all in this together, and together we'll come back stronger than ever. That I have no doubt. You've heard me speak of that before, and I truly believe in that. In closing, I just want to offer up a phone number and a couple of websites. Number one, the Pause hotline from the state. That is, if you see anything illegal going on as it relates to the governor's orders, and typically it's a store or something static. It's not a call to make if you see somebody walking down the street and somebody's 3 feet from each other. That's not what this is for. That's a local police issue. If you see anything egregious that's moving around in front of you. But the Pause hotline are for things that we can investigate. That number is 833-789-0470, 833-789-0470. And again, I'm going to repeat two websites to you: the forward.ny.gov, forward.ny.gov. That is the one that is the website now that is tracking our phase openings. It's a lot of information there for different businesses. People just want to know when places will open up. Also, ny.gov, ny.gov if you're looking for the governor's orders. Finally, your website here in county government, rocklandgov.com, rocklandgov.com. There's a plethora of information there that is designed to help you navigate through whatever situation you may have, most notably what we have here with the COVID crisis.
And just to interject real quickly, because I saw a couple questions in the chat, if you go to rocklandgov.com, there is a link to the face covering, the RockGov face cov request form. It's very easy to fill out and submit it to us, and you can pick those up next week. The information is all there online.
Okay, great. Okay, well, that's a half hour of fun, and hopefully they found the information helpful. And again, all I can offer to all of you is that I'm feeling better about what's going on now. I think if you just think back 4 or 5 weeks ago, we were, in the throes of an out-and-out, full-blown crisis. And I'll remind people that we have faced adversity here in Rockland before. We have always prevailed, always. No matter how tough the challenge, we have always prevailed. I have no doubt we will do that again. What I ask of you, my neighbors now, is please, while we don't have all the answers, we don't have a vaccine for this disease, we do not have any sense it's a natural immunity. That's the difference between COVID-19 and measles. Measles had the natural immunity. When I was a kid, I had the measles when I was 7 years old. They had a vaccine. We're able to attack the virus with vaccine. We don't have that. What we have is our best guess, and that may not provide solace, but you know something? It's worked. The best guess has been social distancing, face coverings, and hygiene. Wash your hands. Don't touch your face with your hands. So these things seemingly are working in a tremendous way. If anybody has seen the numbers, how we've gone up and how we're tracking down now, it's just amazing to see that. So we have to maintain that, and we have to prevent a second wave. And what you can do is be part of the larger community. You may not like wearing a face mask. I'm not particularly fond of it. Well, my face mask maybe look better, but you can be part of the fix. And this is where we work together to get these things done. So I ask all of you, you may not be concerned about your own health, but think about getting this virus, bringing it home to your loved ones, bringing it, going to visit grandma and grandpa. Think about that. Just think about that. And I think you'll get the point. Be inconvenienced a little bit is for the greater good. Let's continue on the path we're on. Let's get through this together. Greater things are yet to come. So with that, have a wonderful, wonderful weekend, a day early.